Okay, go.
Hello, my name is Phelps, and this is my audience.
Courtney, Taylor, Kelsey.
Did you know that 1 in 8 deaths in the world are due to cancer? Cancer causes more deaths than AIDS, tuberculosis, and malaria combined. Bladder cancer can be caused by multiple things, but because of advances in technology, some cases can be cured depending on the type. Today I'm going to tell you all about what bladder cancer is and what causes attribute to it, the different types and stages, and what can be done to help treat bladder cancer. MayoClinic.com states that bladder cancer is a type of cancer that begins in your bladder, which is a balloon-shaped organ in your pelvic area that stores urine. Bladder cancer begins most often in the cells that line the inside of the bladder. The cells form in tissues of the bladder, and rather than divide and grow in an orderly way, these cells develop mutations that cause them to grow out of control and not die. This form of cancer develops most often in people between the ages of 60 and 79, with the average age being 67. My grandma just passed away from bladder cancer at the age of 69, so that's accurate. This disease is one of the most common forms of cancer to strike men, being 3 times more common in men than in women. It's not always clear what causes bladder cancer. According to netdoctor.com, 50% of all cases of bladder cancer are caused by smoking. My Nana continued to smoke while she had bladder cancer, so she didn't take treatments either, so that's why she passed away. It has also been linked to radiation and chemical exposure in your diet. There are 3 types of bladder cancer. The types are transitional cell carcinoma, which occurs in cells that line the inside of your bladder and is also the most common type in the United States. Squamous cell carcinoma is the second type. Squamous cells appear in your bladder in response to infection and irritation. The third is adenocarcinoma, which begins in cells that make up mucus-seeking glands in the bladder. Squamous cell carcinoma and adenocarcinoma are rare in the United States. There are 4 stages of bladder cancer. The first stage, stage 1, cancer at this stage occurs in the bladder's inner lining but hasn't invaded the muscular bladder wall. In stage 2, at this stage, cancer has invaded the bladder wall but is still confined to the bladder. In stage 3, the cancer cells have spread through the bladder wall to surrounding tissue. They may also have spread to the prostate in men or uterus in women. In stage 4, by this stage, cancer cells may have spread to the lymph nodes and other organs, such as your lungs, bones, or liver. MayoClinic.com states that treatment options for bladder cancer depend on a number of factors, including the type and stage of the cancer, your overall health, and treatment preferences. Some of the treatments include surgical procedures, including surgery to remove the tumor, surgery to remove the tumor and a small portion of the bladder, or for the more invasive, surgery to remove the entire bladder. There's also surgery to create a new way for the urine to leave the body. Biological therapy or immunotherapy works by signaling your body's immune system to help fight cancer cells. This is typically administered through the urethra and directly into the bladder. Drugs used through biological therapy include an immune-stimulating bacterium, a synthetic version of an immune system protein. Chemotherapy uses drugs to kill cancer cells. Normally involves using 2 or more chemotherapy drugs through the vein in your arm or directly to the bladder by passing a tube through the urethra. They may be used to kill cancer cells that might remain after surgery. They may be used after surgery, and they may shrink a tumor enough to allow the surgeon to perform a less invasive surgery. Chemotherapy is sometimes combined with radiation therapy, which is the 4th type. Radiation therapy is used infrequently in people with bladder cancer. It uses high-energy beams aimed at the cancer to destroy the cancer cells. Usually comes from a machine that moves around the body, directing the energy beams to precise points. In conclusion, I told you about what bladder cancer is and what can cause it, the different types, and some procedures that can be taken to treat and or hopefully beat bladder cancer. Now that you have heard about the causes, please think before making some of these destructive decisions, and remember that 50% of all cases of bladder cancer are caused by smoking. Please think about things to do to prevent bladder cancer, like not smoking, because then cancer-causing chemicals can't collect in the bladder. Also, take caution with chemicals by following all safety instructions to avoid exposure. Drink water throughout the day because drinking liquids, especially water, may dilute toxic substances that may be concentrated in urine and flush them out of the bladder more quickly. And the last is choose a variety of fruits and vegetables because the antioxidants may help to reduce the risk of getting cancer. Thank you.